techniques right now. What makes us stand out from the other ones is that we are actually backed by research. And this is something our whole group here is very proud of because we put a lot of work into this research project that we actually had published last year in 2024 in the Journal of Upper Cervical Chiropractic Research. So what we have over here is our adjusting. What makes us unique from the other adjustment techniques in knee chest is that we created specific stances based off of the specific subluxation that we see on the patient's x-ray. So it's like BJ told us, it's a tailor-made adjustment for each patient. It's not just an overall blanket adjustment that covers it. Instill with our chiropractors and our students confidence. Because the worst thing is knowing how to adjust, but not knowing if it's time to adjust, right? You've been adjusting a long time, Dr. Callis. I know you can adjust. But the biggest question a lot of chiropractors ask me is, well, how do I know if it needs to be adjusted? A lot longer. Did chiropractic from 18 years old until 79 when he passed away. So let's talk about what chiropractic is according to BJ Palmer. Chiropractic is a philosophy, a science, and art of things natural. A system of adjusting the segments of the spinal column by hand only for the correction of the cause of dis-ease. This is by Ralph Stevenson. So he was one of the top faculty during the 1920s at Palmer, one of BJ's right-hand men over here. He wrote the chiropractic textbook. So here's the key term over here, dis-ease. What is dis-ease? Has anybody heard this in school? What is dis-ease?
It's the lack of ease, so
Here we
it will
go.
be.
So where does the cause of all disease come from then? The spinal column. Somewhere in those 24 bones?
Yeah.
I'm losing my train of thought. Somewhere in those 24 intersegmented vertebrae, there's a subluxation. And that's what we have to find as chiropractors. Where is that block to innate transmission from brain cell to tissue cell that's causing dis-ease? Whatever condition that may be, from colds to cancers. Now, BJ is being very lenient by saying many hours. I'm going to go ahead and bump that up to many years of study. A chiropractor's hands are the same value as a musician's hands. Now, think about that. These are our tools, right? What did these mean to Mozart? Chiropractic history. Those who ignore it will repeat its mistakes. Those who repeat mistakes never develop their potential. Those who never develop their potential never get as many sick people well as they should. So imagine you're trying to develop chiropractic and you came up with something and it works. Oh my God, I discovered something new. Well, then you go back and read BJ Palmer's work, his research, and find out he discovered that and developed it about 30. Not to adjust, we know the direction. Now BJ began to develop specificity in the adjustment. So in 1934, he made a very bold statement to the entire chiropractic profession, where people loved him or hated him for it. He said, prior to this time period, everybody who got well was on accident. So if you got sick people well, don't pat yourself on the back. It was an accident. Now, they were not allowed to share that with the chiropractic side. I'll tell you why in just a minute. So the patient finished their differential diagnosis in the medical clinic and then would move over to the BJ Palmer Chiropractic Clinic. X-rays, neurokilometer scans. Adjust for subluxation only and only when it's needed. And then every 2 weeks, they would go back to the medical clinic. More blood work, urinalysis, whatever workup they had to show that chiropractically